huge job. And I think all of us know, that we often feel like frauds in our work that we can't possibly. But I think that the principles that we use in recovery, and I talk about this a lot, apply to everything that we do. And all I kept thinking was, you know what, first things first, do the next right thing, and you don't do it alone. And that has been really kind of guiding principles for kind of our work. So it's really wonderful to be here today. And I was saying the same thing. This feels like kind of a family dinner, and I'm Italian, and I'm used to having everybody eat and talk at the same time. So please feel free to eat and talk and argue. And so I'm really, really happy and proud to be here in terms of, as Kristen was saying, kind of leaders in this movement and this field. I'm sure all of you are acutely aware that we are doing this work in times of really unprecedented change. While the seeds of change have began long ago, planted by many people in this room, the confluence and speed of change has been happening faster than I think all of us could have imagined. This has been fundamentally driven by a recognition that people with substance use disorders are not bad people trying to be good, but people with the disease who are trying to get well. This has been a time where treatment is seen as an essential health benefit, where treatment needs to be covered like every other disease, where the goals and measures of our success move beyond how many people get treatment and complete treatment, but how many people achieve long-term recovery. Where we no longer arrest and incarcerate people, but we move them toward treatment and care. Where police around the country are not only saving lives, but figuring out ways to help people get access to treatment. Where the recovery and advocacy movement is exploding across this country. Where our president and just about every other presidential candidate is talking about the need for more treatment and a more compassionate response to addiction in the United States. Where we understand the profound effect that language plays on destigmatizing people with substance use disorders. Where we understand that recovery happens in the context of people's communities and people's schools. Where people with lived experience deserve a place at every table. Where a young person in recovery introduces the President of the United States. I'm really happy and a pleasure to be among such prominent leaders, including Bill White, who will be joining us by video, who will honor in a moment, Dr. Andy Finch, who ONDCP honored earlier this year as an advocate for action, as well as Drs. John Kelly and Paul Moberg, who were instrumental in guiding the work of ONDCP early on around recovery and continue to guide our work today. I have often spoken about the inspiration, leadership, and vibrancy that young people are bringing to this movement. Their contributions are a critical success to a national movement to address stigma, remove barriers, and create opportunities for people in recovery. As many of you saw, for National Alcohol and Drug Addiction Recovery Month, ONDCP hosted entitled an event, Recovery at the White House, Young People in Recovery, and we have a couple of people here who were part of that webcast, which was really amazing. It was moderated by Christina Huffington, and we featured a panel of dynamic young leaders who have used their power of their own stories to help youth in recovery. We reached more than 20 million people on Twitter, and there were 111 watch parties held around the country. This level of interest confirms our efforts to increase recovery supportive policies and services throughout the country, and we must also incorporate the unique needs of youth in recovery. During the Obama administration, the issue of recovery has become a priority in drug policy. Using the banner that recovery is possible, we have celebrated the millions of people in recovery who have reclaimed their lives from substance use disorders. We have consistently promoted a life of leadership, health, and giving back. And we are continually knocking down barriers and accessing employment, housing, and education. We are raising awareness that there are millions of loved ones, colleagues, and community leaders in recovery and highlighting their stories. We know that it helps to sensitize the environment in which we create policy. As I have often said, sometimes science and data are insufficient to move public policy, that people move public policy. Thanks to the efforts such as Recovery Month, events like Unite to Face Addiction that was held in October, we are witnessing a shifting in hearts and minds of the public. This has brought us to a pivotal movement where states, the nation, and other countries are actively seeking evidence-based solutions to save lives and restore wellness to families and communities. We understand that substance use disorders are diseases of the brain and that can be chronic and relapsing. But we also know that like other diseases, they can be prevented, treatment, and people can recover. As a field, we have made significant advances in understanding the nature of substance use disorders. Now more than ever, we need a research community to generate and diffuse solid research on recovery to continue to shape evidence-based policy. While there is an ongoing need for solid research to document evidence-based models that effectively facilitate recovery, we are at a pivotal moment in shifting to a public health approach to drug policy that creates a sense of urgency for this research agenda. Indeed, the opportunities for research on recovery are vast, and demands for solid research are tremendous. We are fortunate to have some of the bright and talented researchers and need to expand the pool of researchers who are passionate about conducting and disseminating quality research on these and other critical issues related to recovery. I am honored with the opportunity to present an award to one of the most well-known and highly respected researchers in the field of recovery. Bill White is Emeritus Senior Research Consultant at Chestnut Health Systems, past chair of the Board of Recovery Communities United, and a volunteer consultant of Faces and Voices of Recovery. He has a master's degree in addiction studies from Goddard College and has worked in the addiction fields since 1969 as a street worker, counselor, clinical director, trainer, researcher, and prolific author. I am sure that I am not alone in this room by underscoring the influence of Bill's work on all of our thinking and all of our work. He has co-authored written and co-authored more than 400 articles, monographs, research reports, and book chapters in 18 books, including Slaying the Dragon, The History of Addiction Treatment and Recovery in America, and Let's Go Make Some History, Chronicles of the New Addiction Recovery Advocacy Movement. For the past 25 years, his work has focused on mapping the prevalence, pathways, styles, and stages of long-term addiction recovery. Bill's sustained contributions to addiction treatment and recovery in the United States have been acknowledged by numerous awards from many organizations. I spoke to Bill and I know he was very disappointed that he could not be here today, but he prepared a video message for us. So if we could play the video.